Many of you know someone who's in pain. Heck, I've had both my shoulders put back together. Eventually, I'm going to need to have my knee worked on. My wife has chronic migraines. Her sciatic nerve moved when my daughter was born. How do we deal with these pains? Just like a lot of other people do. We take all kinds of pills. Some work, some don't. Some help a little. A lot of times they don't help at all. So what do? We try another pill. Whatever's next is the one we try. All these have side effects that are horrible. I don't know if you've ever read what the side effects can be, but they kind of scare you. If you ever see the side effects for a pill on a commercial, they make you wonder why you'd ever have to take that pill. But you're looking for relief. What if there was something out there we could all use that has a side effect similar to caffeine? And it's all natural. Something that shows great results in testing. It'd be great if we could try it, wouldn't it? What am I talking about? I'm talking about medical marijuana. Why isn't it used more readily? Why can't more of us get it? Well, that's pretty easy. Because big pharmaceutical companies or big pharm doesn't want us to. Because it'll treat us and it doesn't cost as much. For them, they want to keep us going on the pills as long as they can. Never giving us the full dose that could maybe cure what we have or make us where we have to use less pills. They want us to keep using as many pills as possible so they can keep charging us for it. It seems sad, it seems sick, but to be honest, they're choosing profit over helping us out. A growing number of states, currently 28, have approved cannabis for medical purpose. It treats a host of serious and chronic medical needs, from nerve pain to nausea and anxiety. According to proponents, medical cannabis can relieve pain, reduce inflammation, lessen nausea, improve appetite, control epileptic seizures, and more. In the fall of 2008, an online patient poll, about half of respondents said that they have tried medical marijuana to alleviate their pain or pain-related symptoms and saw great results from this. Considering nearly 30,000 people die a year from opioid overdose in 2014. Think about that. 30,000 people were taking pills prescribed by their doctors for pains that they have, and they died from it. That's crazy. Medical marijuana is becoming widely known as a safe and effective treatment for chronic pain. Individuals with chronic pain can smoke medical marijuana, they can use an oral spray, they can bake it into their food. So it's not necessarily people just going around smoking weed, acting like they're in pain. When they actually are in pain, there's other ways to use it. It's been shown to decrease side effects of the other pills, which is nice. Maybe you could eventually wean yourself off taking the pills. Medical marijuana is safe and affordable. It's considered an affordable treatment that dates back to 1975, when scientists discovered THC was an effective way of treating cancer pain. Since 1975, and we're still not using it all the time. Why? Big Pharma. It comes back to that again. Because it lacks the side effects of traditional medications, medical marijuana is highly desirable for reducing pain in those who are unable to take pills or receive injections. There is also little risk of dependency or overdose, which makes it a safer option than pain pills. Some people can't take pills. They can't swallow them. It just can't happen. Some people can't deal with needles. I hate needles. I mean, that's a sidebar, but needles are terrible. Some people, it just freaks them out. They can't do it. According to a Harvard study published in the Journal of American Medical Association, the 6 chronic pain patients who use cannabis or medical marijuana saw a reduction in the pain levels. Another study published in the Journal of Pain from the University of Michigan found that using medical marijuana decreased side effects of other pain medications, reduced opioid usage by 64% in pain patients, and improved the quality of life of subjects. Results show that medical marijuana works by producing various compounds that treat inflammation and pain by connecting to certain receptors of the body. So, medical marijuana is out there. Obviously, there's a lot of positives for it. I think a lot of the general public that doesn't know about it thinks it's just people want to use it so they can get high or things like that. But it's not true. It's less addictive than most of the pain pills we take every day. It has greater results, greater side effects. Not to mention the whole other argument of the economical boosts it could bring to the country by allowing this. Certain states have legalized it, and they've seen tremendous growth in their revenue for the state. It seems like it's something we'd all want to get into. But overall, I don't see how it could be hard to try. Have I ever? No, I haven't. Am I curious? Absolutely, I'm curious. Because waking up every day in pain is terrible. And I have little pain compared to what a lot of people have. So I think it's something that we need to look into.